I'm Chako Suzuki with Real Self TV, and I am here with America's top dermatologists, including Dr. Bill Coleman. Could you tell me what your specialty is and where you practice?
I'm a dermatologist and I practice in New Orleans, Louisiana.
I have always wanted to go to New Orleans.
One of the great cities.
And what's your specialty?
Dermatologic surgery, especially cosmetic dermatologic surgery.
Let's talk about non-invasive body contouring, specifically UltraShape. Can you tell me how UltraShape is different from other forms of non-invasive body contouring?
Yeah, UltraShape is completely unique as opposed to, for instance, methods of using cold to destroy fat.
Yes.
This uses sound, actually, ultrasound. So it shakes up the fat, makes little holes in them, and allows the fat cells to die and be processed by the body.
So what is best, heat, cold, or ultrasound? What's most effective?
Well, the newest thing is sound, and that's what UltraShape is. And nobody's ever done a head-to-head comparison between these, but I've used all the different instruments, been involved with UltraShape for a number of years and doing research for them. Okay. And this is a unique way where your body does not have to match the machine, as in some cases, but the machine actually customizes and matches your body.
So what exactly happens with the ultrasound? Does it destroy the fat cells? What happens in layman's terms?
It destroys the fat cells completely, so they're permanently gone. So you're always better off having had this done.
Okay, and when they're destroyed, does that mean that they'll pass, or they're like, what's the process afterwards? What happens?
Well, they basically are dissolved by the body, cleared out by the circulation. Your body has an amazing capacity to get rid of fat, like after you eat a Big Mac or something. Just process it right out of your body.
Who makes a good candidate for UltraShape? Is it something where you're like 10 to 20 pounds overweight, or is it a weight loss tool?
It's nothing to do with weight, because weight can so often have to do with muscularity, build, that sort of thing. This is for areas of localized fat. So basically, if you have an inch to pinch somewhere and you want to reduce that, this is a way to do it.
Okay, so an inch to pinch is a great way to see if you're the right candidate. And as far as time off, is this something I could come in and do during lunch or over the weekend, or is it something that needs a little bit of downtime?
Really almost no downtime. You could literally do it at lunch and you could go out to dinner that night.
Oh my God, well that's exciting. And how many sessions typically does somebody need? Is it a one-time thing or how many?
This is a 3-time treatment, and so, but the treatments can be done very close to each other. So our patients come in on day 1, day 14, day 28, and they're done.
Okay, and what is the, when do you need to go further than non-invasive in terms of body contouring? How do you know?
Well, if a person comes in to see us, we try to guide them through all the different possibilities, and there are all sorts of methods out there. I, for instance, have over 30 years of experience doing liposuction, and so we are able to guide patients as to whether or not they're candidates for non-invasive, or using the new methods of liposuction, which are kind of like going to the dentist. I mean, basically, the next day you're on your feet again. I've had a patient fly to Singapore the day after we did her.
Wow, okay. And where are the areas that you can use UltraShape versus liposuction? Are they the same, or?
Not quite the same. You can use liposuction anywhere on the body that you have excess fat, from the face to the feet, basically.
Oh, wow.
Whereas UltraShape all the research was done around the abdomen and the flanks, but it can also be used on the thighs, inner and outer.
And do you see FDA approval coming for other areas of the body in the near future for UltraShape? I
really do. The technology's just been approved, so it took a while to get here, and now the company's trying to enhance the device and make it better for all of us.
Aside from UltraShape, what other things are you super excited about in terms of body contouring? What's coming that consumers should know about?
Well, the other one that's very exciting is called Selfina, and this is a brand new one that is just been FDA approved this year, and this is an actual treatment for cellulite that works. And it involves little cuts up under the cellulite dimples, which may seem frightening, but people are sitting down in chairs the next day, a little tiny bit bruised perhaps, but this has had 100% improvement of cellulite in the buttocks area, which is where it was studied, but 100% improvement of cellulite dimples, where you just basically are erasing them with this device.
Oh, wow. Okay, so women should be looking out for Selfina.
Correct.
With FDA approval.
Yep.
All right. Great. Thank you so much, Dr. Coleman, for taking the time to speak with me. I love it. If you would like to know more about Dr. Coleman, be sure to check out his profile on realself.com. We'll see you next time.